Yeah, it's fine. Maybe you care.
I don't care.
Okay, cool.
Just get my right side.
All right, so we got a few things here. The book's going to show you for elbow flexion, or in the picture rather, that's online on Blackboard. You'll see that there's some pictures that we posted for how to do goniometric measurement. You're going to see that it's supine. Of course, you can position like a towel roll underneath to get them elevated. Sometimes when they're down here, you can't get the goniometer in alignment. So a towel roll sometimes suffices, but I don't have one right now, but I'll grab you guys a few. But if you could hold your arm right there. Go ahead and straighten out your elbow, okay? What I'm gonna do is line up the lateral epicondyle. You can go to the greater tubercle of the humerus and styloid process of the wrist. And we're looking for extension there, and he's got about 0 degrees, okay? Right on the nose. Go ahead and bend for me as far as you can bend, okay? Same positions here, styloid process at the wrist, greater tubercle and lateral epicondyle. And he has about 142 degrees elbow flexion, okay? The easier way to do this, go ahead and sit up for me. If the patient can hold their arm up, I have them go ahead and straighten out, and I do it up here. So it's shoulder flexion, okay? And have them straighten out that way. Perfect. So same measurement, 0 degrees there, or go ahead and bend with his wrist supinated, okay? And that's our flexion moment there. So 142 degrees there. Make sense? Cool. Any questions on that? Elbow is pretty simple. So I always use a big goniometer for the elbow. It's better to use a small goniometer when we go to the wrist, okay? But the thing with the wrist is, so you'll see that there's, in the case over there, you'll see there's these rectangular goniometers. When you do pronation and supination, it's better to have one that's bubbled around. We just don't have a lot of those to go around, so you may have to share, okay? You'll notice in your pictures it has somebody's hand hanging off the table, which is fine to do, but for purposes of demonstration today, we'll just do it, have them seated. Go ahead and bring your wrist back. So go from the lateral part of the wrist, go up, and he's got about, that's all you got?
Right there.
There you go, that's a little bit better. So about 77 degrees there of wrist extension, okay? Flexion, gonna go from the same angle from the other side here. So you line it up with the tricretrum, and we're gonna go into flexion, okay? We're lining up the ulnar side of the wrist and along that hypothenar eminence, okay? So he's got 85 degrees there. For ulnar deviation and radial deviation, so ulnar is going towards that ulnar side of the wrist, radial is going towards the opposite. We're gonna line things up with the middle finger in the capitate. Okay, so go ahead and ulnarly deviate. He has about 42 degrees there. We're gonna go ahead and radial deviate. Obviously, we're gonna have less motion there. We have about 18 degrees there, okay? So for pronation and supination, one of the hardest ones to measure in my opinion, what you have to do is you have to, so go ahead and pronate for me. You have to line up with that styloid process. You don't wanna be down here, you don't wanna be up here, and you don't wanna be all the way out here. If I go down here, I'm only gonna get this far, right? If I go up here, I'm gonna get all the way. So I have to line it up with the styloid process straight across, okay? And then I'm gonna take my measurement that way. Good. He's got 66 degrees there. If he were to bring his elbow out.
Oh yeah, I got a lot more. I'm doing a lot better.
Okay, that's not pronation then, right?
Therapy is totally working.
So you keep the elbow locked in against somebody's side, or you have their hand hanging off the edge of the table, which will kind of help with that. Let's go and do supination. Yeah. So you again line up with the styloid process. You're gonna go ahead and just bring that lever arm down. I would say he's got probably about 88 degrees. You also have to make sure, I always start up here to make sure this lever doesn't move, because I start doing this, I've got more motion, right? So you wanna make sure that's lined up directly just like that, okay? All right, any questions on goniometric measurement?